Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Hematemesis is the vomiting of blood. This is different from hemoptysis, which is the coughing up of blood. Hematemesis is always a serious symptom that requires medical attention. It can be caused by a variety of conditions, ranging from minor irritation to life-threatening bleeding. The amount of blood can vary from streaks of blood in vomit to large amounts of bright red blood. The esophagus, a vital part of the digestive system, can sometimes be the source of hematemesis. Understanding the causes specific to the esophagus is crucial for effective diagnosis and treatment. One of the most common causes is esophagitis, an inflammation of the esophageal lining. This inflammation can be triggered by various factors, including acid reflux, infections, and certain medications. Another significant cause is esophageal varices, enlarged veins in the esophagus that can rupture and bleed. This condition is often associated with liver disease, where portal hypertension, increased pressure in the portal vein, leads to the development of these fragile blood vessels. In some cases, Mallory-Weiss tears in the lining of the esophagus, can also lead to hematemesis. These tears typically occur due to forceful vomiting or retching, often associated with excessive alcohol consumption or bulimia. Additionally, esophageal cancer, though less common, can also manifest as hematemesis in its advanced stages. The tumor can invade the surrounding blood vessels, leading to bleeding. Recognizing the signs and symptoms of esophageal hematemesis is crucial for seeking timely medical attention. While vomiting blood is the most obvious sign, other symptoms often accompany it, providing further clues about the underlying cause. Patients may experience abdominal pain, particularly in the upper abdomen, which can range from a dull ache to a sharp stabbing pain. Difficulty swallowing, known as dysphagia, can also occur, indicating a potential obstruction or narrowing of the esophagus. This can make it challenging to swallow food and liquids, leading to discomfort and potential complications. In some cases, individuals may notice black, tarry stools, known as melena. This occurs when blood from the upper gastrointestinal tract, including the esophagus, mixes with digestive juices, resulting in a distinct black color. Additionally, individuals experiencing significant blood loss may exhibit signs of hypovolemic shock, such as rapid heartbeat, dizziness, confusion, and pale skin. It is important to note that these symptoms can vary in severity depending on the underlying cause and the extent of bleeding. Diagnosing esophageal hematemesis, a step-by-step approach. Diagnosing the cause of esophageal hematemesis is essential for treatment. It begins with a medical history and physical examination. The doctor will ask about symptoms, blood vomited, and medical history. A physical exam checks for anemia, liver disease, and other causes. Endoscopy visualizes the esophagus to identify abnormalities. It uses a flexible tube with a camera to see the esophagus lining. Section 5. Treatment options. Addressing the root cause. Treating esophageal hematemesis requires addressing the underlying cause. Treatment varies based on bleeding severity and patient health. Mild cases may need conservative management. This includes monitoring vitals, IV fluids, and medications. Severe cases may require endoscopic therapy. Endoscopy offers diagnostic and therapeutic options. Techniques include medication injections, heat therapy, and clips. Surgery may be needed if endoscopy fails. Section 6. Preventing esophageal hematemesis. Lifestyle modifications and beyond. Preventing esophageal hematemesis involves addressing the underlying risk factors and adopting certain lifestyle modifications. One of the most important steps is to avoid or limit alcohol consumption. Excessive alcohol intake can irritate the esophagus, increase the risk of esophageal varices, and make existing varices more likely to bleed. Similarly, quitting smoking is crucial, as smoking can damage the lining of the esophagus, making it more susceptible to inflammation and bleeding. Maintaining a healthy weight is also essential, as obesity increases the risk of GERD, a common cause of esophagitis and esophageal bleeding. In addition to lifestyle modifications, certain medications can help prevent esophageal bleeding in individuals at high risk. Proton pump inhibitors, which reduce stomach acid production, can help prevent and heal damage to the esophagus caused by acid reflux. In patients with liver cirrhosis and esophageal varices, medications called beta blockers can help lower pressure in the portal vein, reducing the risk of variceal bleeding. UMCC, your ultimate medical consultant connector.